Welcome back to The Price of Business. I'm your host, Kevin Price, talking to you about you and your business. You know, usually 2 or 3 times a week, I've got someone on from the Heritage Foundation, one of the country's premier conservative think tanks. I've got Robert Moffit on, and he's an expert there, senior fellow for health policy studies. Bob, how long have you been there at Heritage?
Altogether, 22 years.
Yeah, I thought you'd been there for a bit. Let's see, you were there. You got there like in 90, I guess, or 91.
Actually, 91. I'll be 22 years.
Yeah.
91.
So, what were you doing before that?
I was an independent consultant for a firm here in town called the Capital Resources Group. I was there for a little while, but actually before that time, the previous 8 years I spent in the Reagan administration.
Yeah, I knew you, in some context with the Reagan administration. I was there in the 80s. I worked with Amy Ridenour with the National Center for Public Policy Research and several other groups.
Oh, yeah, sure. I'm very familiar with them. I was in the Reagan administration all 8 years. I started as a congressional relations director at the United States Office of Personnel Management, and then ended up at the Department of Health and Human Services as their Deputy Assistant Secretary for Legislation. Yeah. So I was in all the battles of the 1980s. It was a great period, thank God. We had a great president. Yeah,
it was a great period, and he was a great president. So, Bob, of course, we're in very different times today.
Yeah, we sure are.
And so you've got the Obama administration realizing that it was going to get its head handed to him in 2014 midterm elections because of Obamacare. I think he felt pretty confident that that was going to be the case. Decided to delay the mandates and requirements in order to buy some time. There's a lot of people who are saying that the president simply doesn't have a right to do this, even a legal right to do this. So why don't you talk a little bit about that before you get into your topic today?
Well, I mean, I think that's the common sense jailhouse lawyer view, that if you have a law that specifies very clearly a date after December 31st, 2013, the month following that, that a mandate for employers will go into effect, that's pretty clear in the statute. This is the first time in my life since I've been in Washington that I've ever seen a statutory provision amended by a Assistant Secretary of the Treasury, Mark Mazur, who basically decided that we're not going to enforce the mandate for a year. Never seen anything quite like that.
Yeah, so since he's doing it for the small business owner out there, ostensibly, that was a statement that we got from the White House. He is a benevolent despot, but a despot nonetheless.
Oh yeah, I mean, basically, look, I mean, I thought it was very strange that the announcement came in a blog. I mean, we're amending a statute with a blog.
Yeah,
the statute is clear. The statute is very, very clear. There's no ambiguity on the statute. The statute says that, as of January 1st, 2014, any employer with 50 or more full-time employees, that means people who work 30 hours or more per week, are required by law to offer a health care benefits plan that meets the benefits requirements established by the Secretary of Health and Human Services.
Yeah.
It's pretty cut and dry, frankly. And, as far as the legality of this is concerned, I mean, I think it's illegal. I know that I have no doubt that, the Justice Department will come up with some very weaselly language to somehow or other say, well, we're not repealing the mandate, we're just not enforcing it, or we're just, we're not imposing the reporting requirements. They'll come up with something that is somewhat colorable, but it's an indication of the way in which this administration is doing business.
Let me ask you something, Bob. How many times have you seen someone be appointed by a president but had been told by multiple courts, now the Third Federal Appeals Court, that the appointments were illegal, yet they would keep them in those offices.
I've never seen anything like this.
I mean, this guy is arrogant. He's arbitrary. Rule of law is goes down the toilet with the toilet paper. I mean it's just incredible.
Very frankly, I think, because so many things are happening all at once, I think a lot of problems that we're having, I think one big difficulty is that the ordinary Americans are having a hard time absorbing what is actually happening to them.
Yeah.
You can always, ask yourself a simple question, and you were there in the 80s. You can imagine, Ronald Reagan couldn't get away with something like that.
No. My goodness. No,
very seriously. And then, you think about it. First of all,
I hate to say this, Bob. I don't think Bill Clinton could get away with some of this. And he was under a different standard than Ronald Reagan. He could do stuff that Ronald Reagan couldn't even dream of doing. But I'm telling you right now, Bill Clinton couldn't do what this guy does.
Oh, no. I mean, and it's really astonishing. I mean, you ask yourself, how the press would respond if it was George W. Bush saying, "Well, I've decided I'm not going to, I'm not going to enforce this or that statute because I don't like it, or, I know the Congress, passed it, but that's it." The president's primary responsibility under the Constitution is to faithfully execute the law. Mm-hmm. That's not a point of view.
Yeah.
It's not a broad suggestion.
Guess what? You're under the law too, Mr. President. So
and that's the rule of law is, as you know, no man is above the law. Everybody is to be equal under the law. Now, here's the point. I mean, I'm sure that they're breaking out the champagne in the business community about the fact that they got a year's reprieve. It's like anybody else on death row. They're very happy they got another year's reprieve. But the truth of the matter is the law still exists. All of the Obamacare tax increases, there are 16 of them beyond the employer mandate and the individual mandate that are going to go into effect. They're about $1 trillion in tax increases.
Yep.
The IRS has still got all of the enforcement authority that it has, but there's about 47 separate provisions of the law that give the IRS enforcement authority. You have these big entitlements that are coming down the pike. I think for those people who are on Medicare today, I mean, they think, Medicare and Social Security, those are the two big entitlements. Well, we've got a big Medicaid expansion coming, and then we're going to create a new taxpayer subsidy system for the exchanges. Well, according to the CBO, we're talking about another $1.8 trillion in spending.
Yeah. Bob,
I mean, this is just enormous.
My understanding, I only have you for a couple of more minutes, and I do want you to talk about the House vote yesterday.
Oh, yeah.
Talk a little bit about that. Give us some background and then jump right in it.
I think, everybody, anybody who studied Civics 101 knows that, the Congress can propose legislation, enact legislation, has to go through two houses in an identical form, and then it has to go to the president for his signature. The president has said that he will veto both of these bills that were passed pretty heavily, overwhelmingly in the House. The health care, the individual mandate, the proposal was to delay it for a year. It got a vote of 251 to 174. That's a pretty healthy majority. Mm-hmm. And the employer mandate was even bigger. There were 264 to 161 votes. 22 Democrats supported the delay of the individual mandate. Now, that's pretty interesting because the individual mandate is probably the single most unpopular provision of the law. There was a recent survey I saw not too long ago that said, only 12% of the entire American electorate support the individual mandate.
Yeah.
I think what the Republicans did is exactly the right thing to do, and that is...
It's a referendum issue, isn't it? It's a referendum as we go into 2014.
Oh, sure. I mean, put people on record. Do you support this provision?
How many voted present or failed to show up for that vote? Do you know?
I don't recall.
That's always an interesting. Number.
I don't really recall. But the point is that the point of the vote clearly, they don't expect Senator Harry Reid, the Senate Majority Leader from Nevada, to allow either of these things to come to the floor in the Senate. Mm-hmm. But and if it did somehow or other get to the floor of the Senate and pass in some form, I have no doubt that the president will veto it. So, one of the arguments the Democrats are making is that this is just a waste of time and so on. But it's really, of course, as you know, in a democratic republic, a free society, no, it's not a waste of time.
Yeah.
It is exactly what members of Congress should do, which is to hold people directly accountable for their position on public policy. And this is a major issue facing the country. It's not only a question of financing, but it's also a question of how extensively we want the federal government to control our decisions over health care. And that's what's at stake here.
Bob Moffit, he's with the Heritage Foundation, one of the country's premier think tanks. And always delighted to chat with you, gentlemen and ladies, great ladies as well, from the Heritage Foundation. You do a phenomenal job of keeping the American people abreast. I want to encourage people to check out the Foundry, foundry.org. Is that correct?
Yeah, that's right.
Yeah, it's a phenomenal resource. I check it out daily, and I kind of intuitively go to it to the point where I don't even remember the address. But you talk about a treasure chest of information to give you the intellectual tools you need to battle the war of ideas that I think all of us should be involved in. Every single one of us, if you vote, you should be involved in the war of ideas. Bob, thanks so much for being with us.
It's great to be with you.
You bet. All right, also check them out at heritage.org. I'm Kevin Price. Best content here. It shows up over there at usdailyreview.com. When there, like it on Facebook, follow it on Twitter.